Hello, today I'm going to talk about protecting the feet of patients with peripheral vascular disease. So what? Patients with bad circulation, they have higher risk of getting gangrene, ulceration, or even an amputation. So that's why it's important to check up on your feet. So what? Examination begins right when the patient arrives. You may observe his ambulation because the compression of the vessels may cause pain, and you can show it by the way he walks. So, hello madam, you may come in. You can sit please. So, how are you today? Are you fine? More or less. Awesome. I'm going to ask you a few questions, okay? And I want you to answer them very true. How old are you?
I'm 50.
Okay. Do you have any diseases? Do you have diabetes?
Yes.
Okay. Do you smoke?
Yes. I'm smoking.
How long time?
10 years.
10 years, long time, right? Okay, so let me ask you something. Do you feel any pain on your feet?
Yes.
Yes. Okay, so let's check on that. And do you usually examine your feet?
No.
No. Okay, so let's go into the examination bed so you can get a look into that feet. Pode parar. Okay, I got your information here, and now I'm going to check on your feet, okay?
Okay.
So what? It's important to always check on the feet of patients with peripheral vascular disease because of the possible lack of sensation. So what? They may step in some object and they don't even realize that they have stepped on it, and they may have injured and they need to take care of it. So what? You first ask your patient if you can do the procedure and ask him to take off his socks. If he needs help, you can help him. Okay, so madam, can you take off your socks or do you need help?
Yes.
Help? Okay. Excuse me. Excuse me. Okay, now you can check the skin texture and the skin color. You can also check if there is any portion that is hairless, if there is no hair in the area. You can check for any scars, any blisters, any calluses, and you also may check for edema. So like, what is an edema? Is an accumulation of fluids in one peripheral part. So what? What you can do? You can hold press two of your fingers in an area, and then you abruptly take them off, and you look at it. If the mark is still present, the patient has an edema. Okay, so you just look at everything in both feet and ankles. So you may also check the nails, see their color and if they are weak. if there is any deformity. You can also look between the fingers and look at in the calcaneus part next to the ankles. So check of any signs of bad circulation, of any redness in the skin, any vessel that is showing. You should also check the pulses, and try to feel it, if they are weak or not, and make your observations. You can also do some tests to verify the sensibility of this region. So you should ask your patient, and also ask him to close his eyes. So madam, I'm going to check on you, on your sensibility, okay? So I need you to close your eyes, and then you're going to tell me when you feel anything, okay?
Okay. I feel. I feel. I feel. I feel.
Okay, so now I'm going to pass a cotton in your feet, and I need you to tell me where do you feel it, okay? Okay, so close your eyes again.
Dorsal part.
Okay. Now from which feet?
Left.
Okay.
Aí.
So you also should check the response to pain stimuli on the patient. So ma'am, I couldn't find any thing that can justify this pain that you're feeling. Anything besides some minor scratches, scars that you already have, but they are already healed, so I think they are old. But then I'm going to send you to a specialist, or maybe an angiologist, so we can investigate the causes of your pain, okay? This is a diabetic patient that needs some advices to take care of her health and of her feet. So you should advise them about how to take care of it. So, madam, I need to tell you that any little scratch that you can have in your feet can take a lot of time to heal, and it can become infected. So it can lead to major complications and even an amputation, okay? So you need to be attentive of any signs in your feet, any pain, and you should look at it daily to see if there is any scratch, any fissure in any part of the feet or the ankle, to see if it's okay, or if there is a presence of any abnormality. And if you cannot do it by yourself, you can ask a friend or family to do it for you, okay?
Okay.
Okay. And I also need to tell you that diabetes or any other peripheral vascular disease, there is no cure, but you can treat it. You can live with it and prevent any complications by taking care of your health. You should exercise. Do you exercise?
No.
No, that's a bad thing. You should start today, maybe yoga, Pilates, and you can go for a walk for a few minutes in a day, so it can help in your circulations, okay? And you must protect your feet for any injuries. So take care of your house, of the things on the floor, and also make sure that the socks that you use and the shoes, they fit in your feet. They should not be too large or too small. They should fit comfortable on you, okay?
Okay.
Okay. And when you're at home, you should keep your feet elevated this way. We can be with a pillow during the night when you sleep or when you are resting during the evening. Okay? Okay. That's it then. I'm going to help you put your socks. And then you can go. Yeah. Do you have any questions?
I have a problem with my feet.
Not this time, and I really hope that it continues this way, okay?